As nurses, we need to deliver leadership skills and must know our strengths and weaknesses. This was achieved by completing the 9 NHS Dimensions of Leadership self-assessment test. The results showed the weakest areas were engaging the team, leading with care, and inspiring shared purpose. This presentation shows through learning from my course, using practice experience, improvements were made in these areas. My first goal focuses on how to engage the team. The second goal, leading with care. The third is inspiring shared purpose. Leadership and management is important in mental health nursing because it's linked to better quality patient care and patient mortality and a happier and committed workforce, well suited to ever-changing environments such as the NHS. The style promotes interprofessional working, which also has become increasingly important in healthcare. It focuses on having a vision, inspirational motivation, and generates commitment within the team towards a desired outcome. However, Galley argues transformation leadership can focus too much on individual needs instead of the needs of the team, which may cause resentment and impact on goal achievement. Sharing the vision. The goal was to improve leading with care. I noticed my actions in practice showed me this was an area that needed development. During the morning handover, the charge nurse complained patients were insufficiently hydrated, so I volunteered to oversee hydration in line with the values of the NHS's Constitution's commitment to patient quality of care, Department of Health. 2021. Dehydration can lead to dizziness, constipation, urinary tract infections, and possibly kidney infections, which could be fatal. Adopting the transformational leadership style was visible to the team, led by example, and sat and gave water to service users unable to hold a cup. The visibility helped bring the vision to life amongst the staff. I then checked to see if fluid targets had been reached at the end of the day. I prioritised the task of increasing fluid intake instead of helping the occupational therapist with the daily patient quiz. After assessing there were enough staff to do the quiz, hydration took priority over the other duties I had as well. I had a duty of listing patients' belongings who had just been admitted, and I was able to return to this non-urgent task as soon as I'd finished hydrating. Hydration took priority because in the elderly it causes toxic cellular waste build-up, which can be fatal. Once I'd hydrated the patients who were awake, I delegated the hydration task to one of 3 HCA's healthcare assistants on the ward. However, the HCA appeared reluctant to take on board the responsibility, saying they had too much to do. My mistake was that I'd not asked them about their other duties. I've learnt this is important for managers to establish current workloads before assigning extra work. I've learnt it's also important to ensure work is divided fairly. Sometimes when transformation as leaders delegate, it can lead to employee burnout because of too many demands. Jyoti and Bao concur in 2015 this element of transformational leadership could lead to staff finding an additional leadership role too demanding. My learning has shown me to be mindful who is selected for responsibility, particularly if someone either lacks interest or the confidence in getting the task done. Conversely, providing responsibility can elevate self-esteem, and it's empowering, and it shows employees are trusted. The reaction also showed me I'd not helped staff appreciate how their work contributes to the aims of the team, providing high quality patient care. The following day I acted to put it right, and I made sure I checked each HCA's workload before selecting a member of staff to take on the additional role of overseeing patient hydration. And to facilitate the understanding of this, I provided a printout outlining the importance of hydration, the dangers of dehydration in the elderly, and I explained hydration provides patient with the best experience of the NHS, part of the NHS Constitution, and that the NMC's code should include preventing ill health as well as treating ill health. I explained one of the external driving factors within the NHS is inspection and regulation. The Care Quality Commission inspects ratings given by patients' relatives, and any problems experienced by patients due to negligence would be reflecting in rating of the unit and potential lawsuits. I explained by law all care providers must display CQC ratings, and they are visible to patients, carers, relatives, staff and external stakeholders. I explained food and fluid charts were entered into the Paris Healthcare software system, and at any point the CQC may want to see or check these charts. Cooperation appeared to improve as a result of understanding the external and internal drivers behind the vision I was sharing. Feedback during handover 2 days later was very positive, and the clinical lead praised me and the team and asked us to continue with meeting the hydration targets. Engaging the team. The goal was to improve my ability to engage the team, fostering creative participation, raising team engagement, getting feedback and shaping future plans. This was achieved during an episode of care, an acute day treatment unit. I asked the clinical lead if I could take out 70 service users to a nearby forest. The clinical lead asked the occupational therapist to go with me. And this, using the transformational leadership style, nurturing staff motivation, I asked for routes back to the forest. This valued the team suggestion, raised team engagement, creating a common purpose which helped deliver the shared goal. The lectures and the modules show me I need to have more courage to engage the team instead of relying on senior management. Being too sensitive to other people's feelings can be counterproductive and interfere with getting the job done. Too much empathy can trigger altruistic impulses that only benefit one person instead of a team. However, Wilding 2021 argues sensitive leaders with high emotional intelligence make the best leaders. The following week, I improved my leadership style, showing I cared for the values and opinions of the team, and this helped shape our goal of ensuring service users were given beneficial therapeutic activity. This time I also ensured we recorded service users' mood with a mood chart. Assessing my leadership, I should have asked for feedback from the team what worked well and how we could improve. Through this module, I've also learnt the importance of working together to record results, particularly with a new initiative. It's important to involve the team to shape future plans, and collaborative teamwork and problem solving leads to better outcomes. My development needs have shown me to help engage the team. I would also need to communicate the evidence to staff using a printout or a leaflet highlighting the benefits of spending time in nature. The clinical lead noticed the improvement in the mood of the service users returned to the ward and was very positive. She asked the OT to incorporate the task as a regular feature on the ward after I'd finished the placement. Okay, so the goal was to improve my ability of inspiring shared purpose amongst the staff on a particular ward. To do this while staying true to the NHS values using person-centred care. I noticed the patient was in a great deal of stress and I wanted to act as a role model for the service, ensure they got the best person-centred care in line with the NMC. I asked what the patient liked doing and he said going outside and keeping fit. I took a personal risk standing up for the shared purpose of providing care and compassionate person-centred care, going beyond my remit, as this had not been done on the ward in recent times. However, the staff nurse said although they liked what I did, I should have asked another member of the team to accompany me outside due to personal risk. After learning about risk, I adopted a different approach. I asked various HCAs if they'd participated in the outdoor activities because assessing employees' competency is a key internal driver. Having learnt to assess workload priority, I then asked the HCAs what their priority was. They said mealtime. So we agreed to carry out the initiative after mealtime using the transformational leadership style, adopted good communication skills, which helped me deliver the initiative to more patients. The following the clinical lead week, the clinical lead praised my risk assessment improvement and my courage to take on initiative go beyond my remit. I also received positive feedback for involving the HCAs in the initiative, which not only dramatically reduced my personal risk but meant we were able to facilitate the activity to more service users to enjoy. I took the initiative and responsibility to improve patient mental health and supported and praised my colleagues for helping transform the lives of patients who were either suicidal or extremely depressed. It's important that staff feel appreciated. It boosts self-esteem, performance and productivity. I stretched the team with this initiative, which was outside of the regular timetable, and we were providing the best value we could in line with the NMC code. Conclusion. The module has shown me the importance of professional accountability. My leadership skills and confidence are now involved. I've learned transformation leadership is largely based on effective communication. Without good communication, staff may lose interest or trust in their leaders. With open and consistent communication, the transformational leader will receive feedback from staff, which is crucial for monitoring staff's understanding of key objectives, internal and external driving factors, such as patient collaboration, have shown me how this affects the quality of patient outcome. I've progressed well on 3 key areas. With pillars of sharing the vision, I learnt the importance of good communication to staff. Under the pillar of leading the team, I learnt the importance of fostering creative participation. And I've learnt, while courage, the final pillar, while courage is important in leadership, we must still carry out risk assessments in every situation, particularly when moving into new territory and going beyond individual remit, so that staff will continue to provide the highest level of person-centred care in line with the NHS Constitution.